three secondary centers, one for the head and two for the tubercle, which appear at puberty and unite with the rest of the bone after 20 years. So we have a primary ossified centers and secondary ossified centers. Primary ossified centers appears in body of the ribs, and the secondary ossified centers appear at the head, tubercle, and rest of the body. So in the next slide, I'm going to talk about the first rib. If you could remember, the first two 10 to 11 ribs are atypical ribs. So now I'm going to talk about atypical ribs. That's very important to keep in mind, that the typical ribs have different structure, different characteristics from typical ribs. So let's get started with first rib. First rib is the first atypical rib in the thoracic cage. In the identification of the first rib, there are 3 points. Number one is it is the shortest, broadest, and most curved rib. Number two is the shaft is not twisted. There is no costal groove. And the number three is the first rib is flattened from above downwards, so that has superior and inferior surface instead of lateral or medial surface, and outer and inner borders, outer and inner borders, and superior and inferior surface. In the side determination, there are 3 points. The number one about side determination is that the anterior end is anterior end is larger, thicker, and pitted. The posterior end that I'm showing here is the posterior end is small and rounded. Another point is that the outer border is convex and not having costal groove. And another points of the side determination of the first rib is that the upper surface of the shaft is crossed obliquely by 2 shallow grooves separated by a ridge. Number 1 and number 2 grooves, so that's separated with a ridge. The ridge is enlarged at the inner border of the ribs to form the scalenus tubercle. So here is the scalenus tubercle for attachment of the scalenus anterior. When the rib is placed on the horizontal plane with the superior surface facing upwards, both the ends of the rib touch the surface. This is very important to identify and determination of the anterior and posterior end of the first rib. So, about features of first rib, we should keep in mind 3 points about anterior end of the first rib, posterior end of the first rib, and the shaft or body of first rib. The number 1 is anterior end. The anterior end, that is here, I'm showing to you, the anterior end is larger and thicker than that in other ribs. It is continuous. The anterior end is continuous with the first costal cartilage and articulate with the lateral border of sternum. Number two is posterior end. The posterior end comprises the following features. A is head of the first rib. The head is small and rounded. It articulates with the body of first thoracic vertebra, in contrast to typical ribs, head of typical ribs that articulate with two vertebrae, upper and its unvertebrate number. Another features of the posterior head of first rib is the neck. Here is a neck. The neck is rounded and directed laterally, upwards and backwards. Laterally, upward and backwards. Another point is the tubercle. Tubercle of first rib that I'm showing here is a big tubercle after the neck of the first rib. The tubercle is large. It consists with the angle of the ribs. So, in other words, we don't have the atypical angle of the first rib. So, the tubercle and angle of the first rib are each together. It articulates with the transverse process of first thoracic vertebrae to form the costotransversus joint. And the last features of the first rib is the shaft or body. The shaft or body of the first rib has two surfaces, upper, that we are looking at it, and the lower surface, and two borders, outer border and inner border. The upper surface is marked by two hollow grooves separated near the inner border by scalene tubercle. The lower surface is smooth and has no costal groove instead of typical ribs. And the outer border is convex, thick behind and thin in front. And the last point about the feature of the first rib is the inner border that is convex. So I'm going to in a 5 minutes later about attachments and relations of first rib. About the attachment and relations in anteriorly, the first rib anteriorly, the neck is related anteriorly. The neck is related from medial to lateral side. About the neck and attachments and relations of the neck, as you can see here, from medial to lateral side. From medial to lateral side of the neck of the first rib, we have sympathetic chain in a yellow color, posterior intercostal vein in a blue one, and superior intercostal artery that is laterally and it's green and it's red one. Ventral and the last one and lateral to the superior intercostal artery, we have ventral ramus of first thoracic nerve. You can see here is the ventral ramus of first thoracic nerve, and lateral to the T1 we have a ventral ramus of 8 cervical nerves that are passing through the neck and upper surface of the first rib. Another point about attachment and relations of the first rib is Uh, the neck superiorly